All right, next up on the agenda, I'd like to introduce to you our next keynote speaker, Dr. Hani Janeed. He is chair of the Department of Cardiovascular Medicine at UTMB, medical director of the Cardiovascular Care Line, and founding director of the Seeley Heart and Vascular Institute. An internationally recognized interventional cardiologist and researcher, he has led pioneering cardiovascular programs. He's authored more than 340 scientific publications, and he has helped shape national clinical guidelines in cardiovascular medicine. Dr. Janeed will speak on the brain-heart connection. Please welcome Dr. Janeed.
Thank you very much, Mr. Gao, for this kind invitation and kind introduction. Good morning, everybody. I almost did not recognize the person that Mr. Gao was talking about, so I will try my very best to give my best talk on the heart and brain connection. By the way, I reversed it to the heart and brain connection, and you could use these interchangeably, truthfully. Let me see how I can move these slides. Very well. Let me start with a clinical case. I'm a clinical and interventional cardiologist, and this is the case of a patient I did an intervention on nearly 3 years ago. He was 90 years of age at that time, a UTMB retired physician who was presenting with accelerating chest pain, referred to my clinic urgently because of his stuttering angina pectoris. So when I saw him in the clinic, I told him, we're going to admit you and do a cardiac cath on the same day. He said, I want to go bring my cell phone from the car. So despite my negotiations with him, I could not hold him. He had to go to his car. I had my fellow and my nurse follow him to the car, and they found her almost passing out in his car. We rushed him to the cardiac cath lab, and this is his artery. This is the right coronary artery with multiple blockages there. And this is right artery after reconstruction, stenting and angioplasty for 3 or 4 hours. So this is the case of Professor J. Fish. He was the director of transplant and UTMB, renowned physician, scholar, and educator. He died in his sleep last year. I had the honor of taking care of him for nearly 3 years after his angioplasty. We were able to save his life, and Dr. Blackwell, his eminent primary care physician and an aging expert, actually referred him timely for cardiac care. And although we were able to save him, I noticed over the last 3 years that his memory was slipping progressively. To an extent, the last 6 months, he was not able to remember his medications, he was non-compliant, and his quality of life over 2+ years deteriorated markedly. So the heart may determine how long you live, but your brain determines how well you live. And our work now is not only to add years to life, but to add life to years, and both begin where the heart meets the brain. So I hope I can convince you in the coming 12+ minutes that your heart and brain are partners for life. What's good for the brain, or what's good for the heart, is good for the brain. These are essentially two interdependent organ systems linked by shared vasculature, risk factors, and biology, so protecting one would protect the other. So, as you know, the heart is not simply a mechanical pump, but to a large extent, it's a mechanical pump that really pumps at 70 beats per minute on average, thus 100,000 beats a day, driving around 5 liters per minute of cardiac outputs. And this tiny organ, 3 pounds or so, that constitutes around 2% of the body weight, the brain, received disproportionately higher perfusion. So 20% of the cardiac outputs go to the brain. The brain is an obligate aerobe organ, dependent all the time on the heart for perfusion. So the relationship, however, is bidirectional. While the brain is completely dependent on the heart for cerebral perfusion, the brain also controls the heart through its autonomic neural control. I want to give you now two examples how the heart impacts the brain and how the brain impacts the heart, and then go over a preventive measure to promote and improve both cardiovascular health and brain health. One example of heart disease that really impacts brain disease and brain health is atrial fibrillation. It's the epidemic of older age, high blood pressure, and many cardiovascular risk factors would predispose patients to have this irregular heartbeats or rhythm called atrial fibrillation. What happens with atrial fibrillation, there is a stagnation of blood in the upper chamber of the heart, the left atrium that's not pumping adequately because of erratic rhythm. And then there's formation of a clot in one of the outpouching of the left atrium called the left atrial appendage. And this clot can travel to the brain and cause an ischemic stroke. Reducing ischemic stroke through anticoagulation or blood thinner is effective in 60 to 70% of the time. So this is one instance where a heart disease like atrial fibrillation can cause ischemic stroke and deterioration of brain health. However, even with the best anticoagulation, we still can have breakthrough subclinical stroke events. Atrial fibrillation patients have compromised cardiac output and what we call cerebral hypoperfusion. And this is some of the mechanisms why atrial fibrillation patients, irrespective of ischemic stroke, have higher predilection of dementia in their life. So this is one example. The second example I want to show with you is an association between the heart and disease and brain disease. Coronary heart disease is starts really with very early in age, in the first and second decades of life, with fatty streaks. And this is the early precursor of atherosclerosis. You could see on the left corner, this is the cross-section of the coronary artery, the pipes that supply blood and nutrition to the heart. And you can see the plaque building up over time, over years and over decades in these patients. Now, in the midlife, this plaque can impinge on the lumen of the heart and cause blockages and angina, or could rupture, causing heart attack. Now, guess what? This same phenomenon, atherosclerosis, can also affect the microvasculature of the brain. So if you protect the heart arteries by mitigating the risk factors that protect the heart, you're automatically protecting the cerebral vasculature and preventing future cognitive decline. And patients with coronary heart disease have 27% higher risk of dementia, independent of the risk factors they have. So cerebral perfusion and small vessel health. Blood vessels behave like the pipe. You want to think about the pipe perfusing the brain, which sits at the end of the line, and steady flow is what keeps neurons supplied with oxygen and glucose. So healthy vessels leads to healthier cognition. However, chronic hypoperfusion and small vessel disease from atherosclerosis can drive white matter injury and vascular cognitive impairments. So these are two examples how heart disease can impact brain disease. Now, let me flip the equation. How does the mind or the brain affect the heart? One frank example is what we call stress cardiomyopathy. During certain episodes of acute emotional stress or physical stress, there's something that can develop called Takotsubo cardiomyopathy. Takotsubo is after the pot that the Japanese capture octopus with. The heart on angiogram is so weakened and it looks like a Takotsubo. It's called stress cardiomyopathy and is triggered by emotional stress, like sudden loss of a relative or a panic attack or very bad news or even physical stress. And this is related to acute surge of catecholamines and sympathetic activation that can transiently stun the myocardium. Some of these patients may die of cardiogenic shock and heart failure, but for the most part, this is a reversible condition that goes back to normal within no more than 1 to 4 weeks, up to 2 months. Another example is how chronic depression and anxiety can raise cardiovascular risk. So depression can impart 30% higher CHD risk, irrespective and independent of risk factors. Another example how the brain regulates the heart is through the parasympathetic system. There's a phenomenon called the heart rate recovery, and usually after peak stress, if the heart does not recover with slowing their heartbeats more than 12 beats per minute in the first hour, this is a hallmark of a sluggish parasympathetic nervous system, and this is associated usually with increased mortality. So these are just few examples. Another example, by the way, is heart rate variability that's fully regulated by the parasympathetic tone and can regulate heart and can impact overall mortality. And interestingly, regular aerobic exercise improves both vehicle tone and benefiting both the heart and the brain alike. Now, let's go to a very positive note. Nearly 45% of dementia is attributable to modifiable risk factors, according to the Lancet Commission on Dementia Prevention, Intervention, and Care. And prevention is just not possible. It's one of the most powerful tools we have. So what are the risk factors that can be prevented that can cause dementia? And by the way, early on in life, your genetic predisposition is what predisposes you to dementia and cognitive decline. But throughout early adulthood, you develop sociocultural, behavioral, lifestyle, and vascular risk factors, ending with in midlife with symptomatic heart disease, older adulthood with cerebrovascular disease. So what's important is to mitigate these vascular risk factors and improve lifestyle that accumulate over decades. And you need to do this by early and midlife, where you have the highest leverage window. Now, that brings me to the American Heart Association Life Essential 8. So the American Heart really defines, we are now not only treating patients in the hospital, we want to combat heart disease and improve cardiovascular health in our community. So the American Heart Association came up with this concept, Life Essential 8. It used to be Life Simple 7, revised by adding the healthy sleep metric to become Life Essential 8. These are what constitute healthy heart living. And guess what? It's the same prescription for the heart and the brain. If you do these, you not only improve cardiovascular health, but also brain health. So eat better, be active, manage your glucose, healthy weight, manage lipids, manage your blood pressure, avoid nicotine, and healthy sleep, defined as 7 to 9 hours of good sleep duration. And I'm yet to see a cardiologist who sleeps more than 7 hours. Now, there's a strong association between cardiovascular health and dementia and cognitive decline. This is from a French study spanning 14 years follow-up, and you could see the graded response whereby optimal cardiovascular health is associated with higher level of cognition at 14 years in these 3 cities from France. More than 6,000 research subjects followed for a long time. Let me dissect one of the most important measures of cardiovascular health. It's a blood pressure. As you know, 47% of the US adults have hypertension, and the American Heart Association just last year revised their blood pressure guidelines. And we are now looking more and more into tight control, not only in 2025 guideline, but as early as the 2017 guideline. So our target is below 130 over 80 millimeter mercury for a goal. Now, this comes in from many studies, but one of the most central studies is the SPRINT trial, more than 9,000 patients showing mortality reduction when you reduce blood pressure to a tight level, 120 over 80, compared to a more lenient level or more standard approach, 140 over 90. So there was a mortality reduction at an average of median follow-up of 3.3 years, and the curves continue to diverge. 27% relative risk reduction in mortality. Now, the SPRINT MIND is a pre-specified sub-study from SPRINT examining the impact of tight blood pressure control on cognition. And guess what? While the primary endpoint was not met, very positive secondary endpoints with 19% significantly lower risk reduction in mild cognitive impairments and 15% lower risk of the combination of mild cognitive impairment or dementia. So now, tight blood pressure control not only improves survival, prevents stroke, prevent heart failure. We have an impetus for tighter blood pressure control to improve and prevent cognitive decline and mild dementia. Very, very, very important notion. And this is how the heart and brain are very intertwined. As you treat the risk factors for heart disease, you are really treating the risk factors for cognitive decline and vascular dementia, which is really the second most common type of dementia. And as of last year, we do have for the very first time a class 1 indication in adults with hypertension to reduce blood pressure, systolic blood pressure, to less than 130 millimeter mercury to prevent mild cognitive impairment and dementia. I want to end with something we are doing at UTMB. It's called the Galveston Heart Study. We are hoping to enroll in a decade or so 10,000 research subjects in this prospective registry, aiming to examine cardiovascular health, brain health, and aging metrics at baseline and track them longitudinally in our island and in the whole Galveston County. This is the van that's going to the primary care physician offices, to underserved area, as well as to community centers to enroll subjects from the community and from clinics. We're going to measure biomarkers, genomics, coronary calcium scores as a surrogate of subclinical atherosclerosis. We're going to examine social determinant of health, lifestyle, cardiac imaging, and examine outcomes over a period of time. And this is, for the very first time, I'm showing the first 141 subjects analysis. So this is a median of 69 years of age in the first N equal 141 patients. This is pilot phase. And as you see, their median life essential age score is around 68, 100 being a perfect score, 0 is the lowest score. And this is a summary score of all 8 measures of cardiovascular health, each measured from 0 to 100, and then this is their summative score. Now, we're also measuring brain health, and this is the brain care score, and this is a score from 0 to 1, and average was 15 in in a subset of these early pilot patients. And this is a distribution of all 141 patients. Orange is bad, blue is good. The left corner is full of orange, and that's the one measure that's failing tremendously. Guess what measure is this? Diet, exactly. Nicotine actually is doing well, and this is the impact of public policy and taxation. And this is why so many of you are here in the room to impact public policy, because public policy really works. Let me summarize and finish by saying that take care of your heart today, and your brain will thank you tomorrow. Again, what's good for the heart is good for the brain. Optimize cardiovascular risk factors, particularly American Heart Association Life Essential 8, not only to protect the heart, but also to protect brain and cognition, and very importantly, intervene early because risk accumulates across the life course. Thank you very, very much.